Colon cancer symptoms. Did you know that 75% of people with colon cancer have no family history of the disease? In this video, we'll be going over 12 signs you may have colon cancer, even without a genetic history of the disease. Number 1. Persistent abdominal discomfort. Persistent abdominal discomfort, including cramps, bloating, or a feeling of fullness, can also be a red flag for colon cancer. Many people experience occasional bloating or mild cramping, especially after a large meal. But if these sensations are frequent, persistent, and unexplained, it could indicate a problem in your colon. The discomfort may be caused by a blockage in your intestines due to a tumor obstructing normal digestive function. This could prevent your colon from processing waste efficiently, leading to a sensation of fullness or bloating. In some cases, the pressure from a tumor may lead to a feeling of abdominal distension, making your stomach appear swollen or more pronounced than usual. This symptom may be easily brushed off as something less serious, such as indigestion or constipation. However, if it doesn't resolve after a few days or worsens, it's essential to consult with a doctor for an evaluation. Number 2. Fatigue. Fatigue is a symptom that can seem particularly insidious, as it is often attributed to everyday life stressors or poor sleep. However, ongoing, persistent tiredness can be a sign that something more serious is at play, especially when paired with other symptoms such as unexplained weight loss or abdominal discomfort. Colon cancer can cause fatigue due to the body's ongoing battle with cancer, draining your energy levels as your immune system tries to fight the disease. Moreover, blood loss from tumors or rectal bleeding can lead to anemia, which in turn causes feelings of weakness and fatigue. Anemia is a condition where you have a lower than normal red blood cell count, reducing your body's ability to carry oxygen to tissues, making even the simplest activities feel exhausting. If you're constantly tired despite adequate rest and a normal lifestyle, consider consulting a healthcare professional for further investigation. Number 3. Nausea and vomiting. Though less common, nausea and vomiting can occur when colon cancer affects your intestines. A blockage in the colon, due to a tumor, can lead to the backup of waste and digestive fluids, resulting in nausea, vomiting, or even the inability to keep food down. If a tumor is large enough to obstruct the passage of waste, food cannot pass through properly, causing discomfort in the form of nausea or vomiting. This can also lead to dehydration and further complications. Nausea and vomiting, particularly if persistent and unexplained, should be thoroughly investigated, especially when they occur alongside other colon cancer symptoms. Number 4. Iron deficiency anemia. Colon cancer can cause gradual blood loss, which may lead to anemia. As the tumor grows, it can bleed slowly into your colon, often without being noticed. Over time, this can deplete your body's iron reserves and result in iron deficiency anemia. Symptoms of anemia include pale skin, dizziness, weakness, and shortness of breath. Iron deficiency anemia can cause a noticeable decrease in energy levels and make even routine activities seem exhausting. If you are diagnosed with anemia and the cause is unclear, further diagnostic testing may be needed to rule out colon cancer or other gastrointestinal issues. Number 5. Difficulty passing gas. While passing gas is a normal bodily function, difficulty in doing so may be an indication of a problem within your intestines, such as a blockage. Colon cancer can cause obstruction, which may prevent gas and stool from moving properly through your digestive tract. This may lead to bloating, discomfort, or a sensation of fullness. If you notice that you're unable to pass gas, or if this symptom is accompanied by other issues such as constipation or abdominal bloating, it's essential to see a doctor to determine if the blockage is due to a tumor or another issue. Number 6. Unexplained weight loss. If you're experiencing significant unexplained weight loss without any changes to your diet or exercise routine, colon cancer could be the culprit. Weight loss often occurs as a result of the body's reduced ability to absorb nutrients from food due to blockages, or the disruption of normal digestive processes caused by cancer. In addition, colon cancer cells can consume your body's energy and cause a general breakdown of muscle and fat. This leads to gradual, often unnoticed weight loss over time. If you're losing weight despite eating normally and not engaging in increased physical activity, it's a concerning symptom. Weight loss is often accompanied by other general symptoms like fatigue or weakness, and should always be addressed with a doctor. Identifying the cause early can be crucial for effective treatment and intervention. Number 7. Feeling of fullness. Many colon cancer patients report a sensation of feeling full even after eating very little. Similarly, you may feel an urgent need to have a bowel movement, even if your body doesn't actually produce stool. This sensation can be caused by tumors that press against the wall of the intestines, causing an unnatural feeling of fullness or urgency. This constant urge to empty the bowels may be caused by a tumor obstructing normal colon function, preventing the normal passage of stool. Tumors in the rectum or lower colon can also cause this sensation of incomplete evacuation. It's not only uncomfortable, but also distressing, as it often impacts the quality of life, causing anxiety or frequent trips to the bathroom. If these sensations occur frequently and disrupt daily life, it's important to talk to a doctor. A colonoscopy or other imaging tests can help identify the underlying cause. Number 8. Blood in stool. Blood in your stool is another obvious sign of colon cancer, though it can also occur due to other conditions, such as hemorrhoids or anal fissures. However, when blood appears consistently or in significant amounts, it should not be ignored. The blood may appear as bright red streaks on the stool, or may darken and mix throughout the stool, depending on where the tumor is located. If the blood is bright red, this typically indicates that the source of the bleeding is closer to the anus or lower part of the colon. Darker blood, or melena, can suggest that the bleeding originates from a higher portion of your colon. Regardless of the color, any visible blood in your stool should be evaluated immediately by a healthcare professional. This symptom, when present with others such as abdominal discomfort or unexplained weight loss, can be a key indicator that colon cancer is the cause. Number 9. Family history of colon cancer. While this is not a direct symptom of colon cancer, a family history of the disease increases your risk. If colon cancer runs in your family, especially in first-degree relatives like parents or siblings, your risk is higher than average. People with a family history of colon cancer should begin screenings earlier than the general population, and may require more frequent checks to detect potential problems early. Being aware of your family's medical history is vital in helping you understand your own risk factors. Discussing this with your healthcare provider is essential for determining an appropriate screening schedule and proactive measures. Number 10. Pain in the rectum or anus. Pain in the rectal area, including discomfort, itching, or soreness, can sometimes signal that something is wrong, such as colon cancer or a related condition like hemorrhoids. Pain during bowel movements, particularly if the pain is sharp, constant, or increasing in intensity, is something that should not be ignored. Rectal pain is often associated with tumors located in the lower parts of the colon, including the rectum. As the tumor grows, it can cause pressure and irritation in the surrounding tissues, leading to discomfort or even pain. In cases where rectal pain is persistent, it is crucial to consult with a doctor to rule out colon cancer or other possible conditions. Number 11. Change in bowel habits. A noticeable change in bowel habits is another common sign of colon cancer. This can manifest as diarrhea, constipation, or a feeling that your bowel movements are incomplete. If you've had consistent bowel habits throughout your life and suddenly notice a change, especially if it persists for weeks, it could be worth investigating further. Colon cancer can alter the normal movement of stool through your colon. Tumors can block or narrow parts of your colon, leading to constipation or difficulty passing stool. Alternatively, some people may experience episodes of diarrhea, as the colon struggles to absorb water and nutrients from food. A sense of urgency or an inability to fully empty the bowels is also common in those with colon cancer. These symptoms can be mistaken for other digestive disorders, but if they don't improve or go on for an extended period, it's crucial to talk to a doctor about further testing. Number 12. Rectal bleeding. One of the most alarming symptoms of colon cancer is rectal bleeding. While it might seem troubling, many people dismiss it as something minor, such as hemorrhoids. However, if you notice blood in your stool or on the toilet paper, it's important not to ignore it. Colon cancer can cause tumors that may bleed, leading to visible blood in your bowel movements. The blood can be bright red, indicating that the bleeding is coming from the lower part of your colon or rectum, or darker in color, which suggests the blood is coming from higher up in your colon. Regardless of the color, any instance of rectal bleeding warrants immediate medical attention. Tumors within your colon or rectum can irritate blood vessels, causing them to rupture and bleed. The blood loss might be gradual, leading to iron deficiency anemia, which only adds to the complexity of the issue. If you experience rectal bleeding consistently or notice blood in your stool, it's crucial to seek medical advice. Those were the 12 signs of colon cancer. Did you know that colon cancer can increase your risk of developing fatty liver disease? Check out this video to learn about 12 signs you may have fatty liver disease. Thanks for watching. See you in the next video.